Welcome to day 2 of the multi-level interventions in healthcare. Come on in and have a seat. Hope that you've had a good night's sleep and a good time here in Las Vegas. I tell you, if there's any place that understands multi-level interventions, it's Las Vegas. It's very clear what their field is here. Gamble and buy booze. All right, thank you. So, welcome, and we're going to hear a recap of yesterday from Dr. Kaluzny. Dr. Kaluzny actually needs no introduction.
Thank you very much. You're very kind. No introduction. I forgot my name tag, so it's a good thing that somebody's got a memory here. My assignment was to wrap up the discussion of yesterday. And wrap up may be a bit of an overstatement. If you were in this room yesterday at all, we covered a tremendous amount of material, different ideas, and I'm going to try my best. But clearly, we had a very productive day. We covered 2 of the 3 sessions, or 3 of the sections that I originally outlined in terms of the introduction, the conceptualization. Jane gave a very nice illustration. We had a state-of-the-art by Kurt to review. We went through challenges and opportunities, and we ended the day with Dick Scott suggesting an alternative perspective, or maybe a complementary perspective, in terms of focusing on fields with the centrality of organizations and the importance and permeability of boundaries between these fields, which I think is a really intriguing kind of idea that we're going to have to reflect on and see how this fits within some of the other papers. And I want to thank him again for making that those comments and giving us a slightly different perspective from where we were at the very beginning. The task, however, is to look at some of the developments that occurred over the past, or some of the ideas that occurred over the past day. And I was just talking to Pat here, who came up and reflected on a person that we know, Cecil Sheps. And he's a sort of a legendary person in the health services field, medical care. Some of you may or may not know of him. But he was very good at sort of summarizing meetings, and I'm not sure I'll ever be able to come to that state, but he had sort of a general rule that he would point with pride, view with alarm, and close on a note of hope. And so I want to make my comments within those 3 categories. If we point with pride, I think it would be fair to say that as described in diplomatic circles, discussion was frank and far-ranging. I mean, we really covered a lot of material, and not on trivial matters. I mean, these were really a very substantive kind of discussion. More importantly, at least as we viewed things here, people were very engaged with the topic in a serious sort of way. They sort of stayed on message with this kind of thing. And I think both Steves were rather relieved that nobody got up and said, whoever thought of this thing should leave the field. You know? So, I mean, that just right there is a real success. I think another thing we can point to in terms of pride is, while everybody really respected the complexity that we encountered when we talk about multi-levels along the continuum of care and so forth and so on, I think it was also grounded in reality. Okay, a lot of discussion was talking about additive learning. Okay, not launching research within the Big Bang perspective, but really having a set of priorities and moving very systematically with that. There was some comment about the fact that we perhaps may not want to forget everything we learned in obedience school, but build on what we've learned and the lessons of the past as we move forward, which was very encouraging. And I think there was a willingness across the board, now this is my consensus, that we were willing to look at new models, but also to see the applicability of some models that are already in place, that we can tap into as we try to think in terms of multi-levels and creating a research program in a relationship with ongoing organizations. The Cancer Research Network is probably a very good example of that kind of thing, which is this going for almost 20 years, I believe, 15 years for sure. I remember being on the original review of that, in which these are large health systems, HMOs, setting up a common database and collaborating over a period of time to work on various research projects, which is a very powerful idea that hopefully will continue and provide some ideas and some learning for us as we think about multi-levels for issues that we discussed yesterday. I think when we talk about alarm, point with pride, view with alarm, I think there was a sense that we might have underestimated the complexity involved. And this is not only the conceptual complexity, but the reality of the logistics of making this happen, okay? We talked about the problems of study sections, okay? We talked about the whole notion of what it would take to get study sections focused or get them staffed in a way that we would have people on the study sections who would in fact appreciate something like this kind of thing. I think Steve mentioned 17 years. I remember that number. I'm sure it's got firm documentation, but it's probably right. We're talking about a fairly substantial time element here. Moreover, the whole notion of developing trust for the number of people involved, because when we talk about multi-levels, you're talking about a whole new set of stakeholders that are going to be involved with this organization. And the complexity involved with that, I think, is really quite challenging. One of the things, and this may be unfair because we have Kelly Devers sitting here and she's going to be talking about healthcare reform, it just occurred to me as I was reflecting yesterday that we passed major legislation, and while there's a tremendous amount of uncertainty, it really wasn't that prominent in our thinking yesterday as we were talking about these kinds of things. And this is not going to be business as usual, and this might be my own idiosyncratic view, but this was a concern to me that I think, from my perspective, would have been far more prominent in the discussion yesterday than it was, even though we have a session dedicated to that today. So we'll have to reflect and see how this influences our thinking after we hear from Kelly and how she comments on the implications of healthcare reform on what's happening in terms of this research. The other view with alarm, which I think was brought up a little bit by Dick Scott's comment towards the end, that we really need to pay attention to the changing values and norms that occur within the country and the permeability of these boundaries within these different fields. And the contemporary events that we see within our country, both at the federal and the state level, to me at least, is very disconcerting in terms of how science is being viewed, the kind of trust which is being challenged in terms of public service, and science is considered a hoax, and I think this is a real problem when you begin trying to introduce new ideas as complex as what we're talking about here with multi-level interventions. when we look at the hope aspect, close on a note of hope, clearly a dialogue has begun. And hopefully, the hope element is that this is the beginning in which it'll continue to proceed, not only among this group in one way or another, but adding some of the other stakeholders that we mentioned yesterday, which have to be major players in this if we're even going to come close to realizing what's happening. Another element of hope, hopefully this really will happen because I think the implications will be substantial, is in terms of the publication of this effort within the JNCI. And the visibility and legitimacy that this is going to give to this endeavor is really quite significant. Both Steves, with the help of Ernie Hawk, were able to invite Harvey Feinberg, who is the president of the Institute of Medicine, will write the preface and the foreword to that, which is a very, very significant kind of thing, because this is a major endorsement of one of the most prestigious organizations that this is an important area that we're now entering and needs to be considered. Finally, I think the product will provide the basis for a research agenda, a set of concepts that go forward. And I think one of the things that I was very pleased to hear, not so much from the podium, but in some side conversations, is the fact that we're beginning to think about mechanisms for dissemination of this kind of thing. One of the suggestions that Leska Pasquet mentioned to me was the fact that we ought to be talking to journals and journal editors so that this kind of thinking gets some kind of visibility. And while it would be very, very nice to have a dedicated journal, because I think the journal Implementation Science has really moved implementation activities forward. I think a journal that would focus on multi-level interventions in the context of this would be very powerful, very helpful in moving this thing forward, but also just simply having special issues of existing journals that would give researchers who are moving in this area a chance to share their ideas with other people would be one of my big hopes if we're going to be successful in truly implementing this kind of idea. Let me stop here, and I think, Lisa, this is my view of the day that we had yesterday, and I look forward to a very exciting and productive time today. Thank you very much.
Thank you, Arnie. Arnie, it's been just a tremendous addition to our team in providing leadership and insight and direction and expansion of what we're thinking in our connection. So I really appreciate his leadership.